All right, I have 10:02 in my clock. Buenos dias, Cecilia. Buenos dias, everyone. So welcome to this webcast this morning, Friday morning. We're really happy to have everybody here today. We're gonna be hosting the webinar titled Promoviendo el Bienestar, Self-Care Cultural Considerations for Hispanic Latino Frontline Workers. Before starting, we're gonna share a few information about the center that is providing the webinar today. Go with me. Today's webcast is brought to you by the South-Southwest Mental Health Technology Transfer Center, an initiative founded by the Substance Abuse and Mental Health Services Administration to provide free training and ongoing consultation to the diverse array of professionals that serve individuals with mental health challenges across our 5-state region. You'll see that region 6 is the one highlighted in purple, which includes Texas, Oklahoma, New Mexico, Arkansas, Louisiana, and several tribal communities. The Mental Health Technology Transfer Center, or MHTTC for short, is a project of the Texas Institute for Excellence in Mental Health, which is housed at the Steve Hikes School of Social Work at the University of Texas at Austin. One of the things that we like to do in every webinar is to do a land acknowledgement. We are standing in the traditional land of the tribes Alabama Cushara, Cado, Carrizo, Comecrudo, Coahuiltecan, Comanche, Kikapú, Lipanapache, Tonkawa, and Isleta del Sur Pueblo, and all the American Indian and indigenous peoples and communities who have been and have become a part of these lands and territories in Texas. We acknowledge the painful history that has brought us to reside on these lands, and we seek to evaluate the effects of settling colonialism and our participation in that process, searching ways for the healing of intergenerational trauma. We honor the indigenous caretakers of these lands and waters before us, the indigenous peoples today, and the generations to come. This is our great team who all contributed to make this event possible. And we honor and use affirming, respectful, and recovery-oriented language in all activities, which means that the language is strength-based and hopeful, inclusive and accepting of diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, and consistent with our actions, policies, and products. We welcome you all again to this great webinar. We're so excited to have this great experts with us today. We have Dr. Elizabeth Chavez Palacios and Dr. Andrea Almaguer Botero. Dr. Elizabeth Chavez Palacios obtained both graduate degrees at the University of Texas Pan American, aka University of Texas Rio Grande Valley. She obtained her master's degrees in clinical psychology in 2006 and her doctorate in rehabilitation counseling in 2013. Her dissertation and current research interests include Latino Hispanic cultural issues, substance use disorders, clinical supervision, and bilingual counseling issues. She has been providing mental health services to the residents of Texas over 14 years in a variety of settings. She has been teaching at UTPA, UT Rio Grande Valley, formally since 2013, but had served as a teaching assistant to the SRSC since 2009. In addition to her service in academia, Dr. Chavez Palacios is the program director at Evolving Steps Counseling, a comprehensive mental health services facility with a focus on substance use disorders in adolescents. And of course, in her spare time, she enjoys time with her husband of 17 years and their children, Jesus, Elena, and Joshua. Welcome, Dr. Elizabeth. And we also have Dr. Andrea Almaguer Botero. She has a master's degree in counseling psychology with a bilingual counselor certification from Texas A&M International University. In May 2020, she earned her PhD in rehabilitation counseling at the University of Texas at Rio Grande Valley. Her dissertation and current research is focused in mindfulness and mental health. Dr. Almaguer Botero has worked as a professional counselor in different types of settings, such as immigration and refugee centers, substance abuse clinics, schools, and hospitals, providing trauma and crisis counseling. Dr. Almaguer Botero has taught and currently teaches undergraduate and graduate rehabilitation counseling courses. Her areas of interest include the Latino population, mindfulness, trauma, spirituality, immigration, and substance use. She's currently working in the neonatal intensive care unit department, providing mental health services to mothers of NICU babies. We're so excited to have you both here for this great webinar today. So Dr. Elizabeth, Dr. Andrea, the stage is all yours.
Muy buenos días a todos. Thank you for being here this morning.
Good morning. Thank you for having us. We're very excited to be here and give this presentation today in the morning.
All right, so we'll go ahead and get started this morning, just in the interest of time. So this morning we're going to be talking about overall just well-being and self-care with regards to Hispanic and Latino frontline workers. So Promoviendo el Bienestar, self-care cultural considerations for Hispanic Latino frontline workers. Again, I'm Dr. Elizabeth Chavez Palacios, and joining me this morning is Dr. Andrea Almaguer Botero. So our objectives, as were delineated prior to you signing up for today's webinar, you saw that we're going to be addressing various topics. So first and foremost, we want to help you identify and differentiate between stress, burnout, and compassion fatigue. Increase your awareness as to what your stressors and or triggers may or may not be. Identify healthy and unhealthy coping skills. Learn about the importance of self-care and how to identify various self-care options, as well as the cultural considerations or implications of self-care within the Hispanic or Latino culture. So again, some of the topics overall that we're going to be discussing, and just kind of a brief overview of each. Healthcare in Hispanics, we're going to talk about stress, Hispanic culture, self-care, wellness, and the Hispanic Latino population, and various resources that we will be providing to everyone today. So again, in the chat section or in the question or the Q&A section, if you can go ahead and just drop us a line, tell us where you're from and what type of work you do. We want to see what where folks are from and what type of jobs y'all are doing out in the community. So here we go. Healthcare and Hispanics. So I'm going to leave it up to Andrea right now to go ahead and present on the next few slides. So whenever you're ready, Andrea.
Yes. So first we're going to talk about the healthcare and Hispanics, but we're going to start off with just general health concerns that we see in the United States. So the top chronic diseases that are common in the US are heart disease, cancer, stroke, chronic lung disease, Alzheimer's disease, and diabetes. 6 in 10 adults in the US have a chronic disease, and 4 in 10 adults have 2 or more of these chronic disease. So we have tobacco use, poor nutrition, lack of physical health, excessive alcohol use, and aging are risk factors associated with this chronic disease, right? So what we see for Hispanics when it comes to the US and the population in the US, we see that heart disease and cancer are the top leading deaths for Hispanics. However, before stroke for Latinos or Hispanics, we have diabetes and liver disease. So we see that for diabetes and liver disease, Hispanics are 50% more likely to die from these diseases than whites. And so we'll jump to the next slide. Okay, there we go. Okay, and so again, just a little bit more, more specific to Latinos. 18.5% of the U.S. population are Hispanic and Latino. So we know that this is one of the biggest minority groups in the United States. Keeps growing, right? And I believe I read in the census report that by 2035, 1 in every 4, I guess, in the US was going to be a Hispanic or Latino descent. So we are growing really fast. The life expectancy of Hispanics in the US is 81 years. So compared to whites, this is 78 and 74 for African Americans. So if you guys are in the medical field, you might be aware that Hispanics, the treatment for Hispanics are often viewed as incompatible with the Hispanic needs. So what does this mean? It means that the treatment is not sometimes culturally adapted, right? So the treatment we get in the medical field might not be adapted to whatever the Latino needs are. So there is research that shows that Latino patients tend to overexpress the pain they are feeling, and research shows that doctors tend to administer less medication to minorities. And so there's a lot of inconsistencies to what the needs are and what's being provided when it comes to the healthcare. Latinos are more likely to let more serious, chronic, and disabling presentations of mental health disorders progress. So, right, we what we say in Spanish, right? Nos aguantamos, o todo, no pasa nada, todo está bien, and we kind of wait it off, right? So Latinos are more likely to let these type of chronic diseases and symptoms go on for a longer period of time before we reach out for help. Okay. We can go to the next slide. Thank you. And so, of course, right, if you guys identify as Hispanic or Latino, right, we know that a lot of these traditional religious beliefs, they persist over generations, right? We teach them to our kids, we learn them from our parents, from our grandparents, and sometimes we still may do the la bendición or use Vicks, right? So a lot of religious and traditional beliefs, in Latinos and Hispanics may pass over with generations. Now, there's research that shows that, when we think about the traditional Latino health beliefs, they are grouped into two categories. So we have the conventional type of health beliefs and the complementary. So the conventional includes medicine and religion, and the complementary includes those folk illness type of, el ojo and all those kinds of things. Right now, I'm going to show you a really nice table, and I will explain some of the samples. But for conventional, either we go to the doctor, right? We're sick, we go to the doctor, or we reach out for any type of religion beliefs that might help us feel better, right? And have these beliefs of, si Dios quiere, Dios mediante. So we leave a lot of that, I guess, locus of control, right, to our beliefs. And then for the complementary, this also includes the herbs and natural remedies that are very common in the Latino culture, right? So your stomach hurts, there's all these natural remedies that our grandma can probably give us, or tell us about. And so, for those that are in the mental health field, in the DSM-5, these type of cultural, folk illness, so what we're talking about, the complementary, this would go under like a diagnosis of cultural concepts of distress, right? And so right now I'll give you some examples, but this is, all of this, in general, it's just so important that, as healthcare providers, and that healthcare providers are very, very culturally attuned to these type of, illnesses perceptions to better develop the treatment that we're giving our patients, right? We need a comprehensive health care plan for Latinos that meets their needs. And so in the following chart, in the next slide, we'll see how these health beliefs are separated. So we're kind of going to go through columns, right? So if you see in the gray area, we have problems, and then underneath we have helpers. So if we go through the medical column, right, we see conventional. Medical falls under the conventional type of health beliefs. And so this is a common universal illness. So we're sick. The helper is a physician or psychotherapist, right? Now, if it's a religion type of problem that we're having, we reach who are the helpers, right? This is a priest, a pastor, we pray. And so these type of problems, such as illness, sin, and guilt, and stresses, are usually resolved by, when we think about religion, they're resolved by priests, pastors, and prayer. Now, for witchcraft, you know, I'm sure you guys, you know, within the Latino culture, this is very common. So if we see the, what we say, mal puesto, ghost, you know, all that jealousy, envy, anger, and then they reach out for espiritistas, santeros, which are healers, right? And so I was thinking of some samples that I've seen now. When I worked at the Immigration Refugee Center, I got to work a lot with a lot of Central American and South American nationalities. And so they did share one, it was like a very similar story between different nationalities that was very interested to me, right? And so they would say that, and I believe this falls under, I think, mal puesto. And so what it was that they would see a leprechaun. And so the leprechaun would follow like a pretty girl, let's say. And so if the leprechaun put, you know, his eyes on you, right? This was the belief. This person was, I guess, had a spell, right? And so a lot of the patients I had would say that they would, in order for that spell to be unmade, they would have to eat in the restroom. And so, of course, you know, this in particular, like I had never heard about. And so I'm here listening to these stories, right? And so trying to adapt, you know, a treatment that, you know, and trying to find a diagnosis, but also not, you know, you don't want to diagnose as being psychotic when you know that this is a health belief from that culture, right? So you always want to be culturally adaptive to these things that we hear, right? And now this was like in a counseling setting, but these are also things that happen, you know, in the medical area that, you know, they might reach out to a doctor, but they might have some beliefs that are culturally related as well, right? And so, and then of course we have the mal de ojo, right? Which I'm sure you guys have heard about, the susto, empacho, nervios, ataque de nervios, which is sometimes, ataque de nervios might sometimes be very similar to a panic attack. And so when we have these folk illnesses, we'll reach out to curanderos, hierberos, sobadores. So, you know, what we see is that Latinos might reach out sometimes to the complementary type of help, right? Before maybe reaching out to the medical help. They'll try their own stuff, right? Before trying the actual, you know, medicine. And so right now I'm gonna share with you guys some, in the next slide, some further information on Hispanics and their perception. Okay, please go ahead and put any questions you guys might have in regards to anything that we're talking. We'll try to answer. Okay, one more. There we go. Okay. So, you know, I was, when we say, you know, when we were you know, had the title and we talk about frontline workers. So I was looking, you know, well, what is frontline workers? Because this, you know, the healthcare workers word, frontline workers, also came up a lot, right, within the last year with COVID. So I wanted to clarify a little bit about, you know, what is frontline workers, right? So according to the National Bureau of Economic Research, a frontline worker or essential worker are those that are considered vital for the core functioning of societal infrastructure. So we saw this, right? And in COVID, this was just like an you know, a time where we're able to identify who the frontline workers were. Who are those that can't, you know, who couldn't be at home, that we need this thing to keep running. And so what they explain, the way they identify who frontline workers are and why it's important, it's because we need to make sure that the proper resources are given to them in such you know, crisis, and in such a crisis time, whether it's, you know, COVID-19 or any other time of crisis. So of course the industries vary, right? So there's frontline workers, but there's a lot of frontline workers. This is healthcare workers, police, cashiers, like we saw, you know, the HEB workers had to, you know, be going during COVID-19, janitors, we have the agricultural workers and truck drivers. So these are some of the industries that are considered frontline workers, right? Now, according to the National Bureau of Economic Research, frontline workers share certain characteristics, and this is less education, lower wage, higher representation of men, minorities, especially Hispanics and immigrants. Now, as I was looking into this, I guess I really hadn't put much thought into it. I actually went through this COVID-19 pandemic through the hospital because I'm currently working at a hospital. And so for me, the characteristics of the healthcare workers were obviously, it wasn't less education, it was, higher education. And so I guess my perspective of the characteristics between frontline workers were a little different, right? Because of what I lived through. But as I was reading this research and this report, I thought it was very interesting that, in reality, when we think of the frontline workers, the janitors, agriculture, cashiers, the truck drivers, it is minorities, the people facing this crisis were minorities. Now, if we go back to what we were talking about in the beginning, we're saying, Hispanics often lack the care that they need, right? They don't reach out for the help that they need. And so I thought, this is so concerning. We're going on a year and a half of dealing with this crisis, right? And to think that most of these people that are dealing with all this stress, right, and had to be on the front were minorities, right? And maybe people who are not insured or might not have the proper resources. Now, for healthcare workers, I believe that when they broke it down to the characteristics, the doctors were white males, like a big percentage. But besides doctors, if we removed doctors and we had like the nurses and anyone else from the healthcare field, they were all still a big percentage was still minorities. And so what I also was reading was that, with COVID-19, we had to they changed the definition of frontline, because frontline was, I believe they had like at home and and working in person. And so with COVID-19, they changed this word. What frontline workers are those who provided labor in person. So those are the ones that we're talking about, that right now, the healthcare workers, police, cashiers, those that have to be in the front line. And so, like, we're talking about, the Hispanics and thinking about the last year, right? And all these stressors that our culture can
Okay,
can
I
you hear
don't
me?
know. Okay, yeah, now we can hear you.
off.
I was wondering.
Yeah, I'm sorry. And so, okay, you can hear me, right?
Yes.
Yes, we can hear you now.
Okay, perfect. And so when we're talking about, all these frontline workers and Hispanics going through all this stress, right? Well, we think, well, what stress, right? And how does stress affect our well-being? And so what we see is that, I'm gonna go into the definitions of stress in the next slide. Perfect. And so stress is defined as, stress arises when an individual perceives that you can cope with the demands that are being made on them, right? So, stress is so different for everyone, right? What's stressful for someone else might not be as stressful for me. So I think a key word here is perceive, right? How do we perceive that stress? And do we have what it takes to overcome that stress, right? So let's say a stressor is something dealing with money, right? So someone who might have money might not perceive it as such a stressful event because they might have the money to deal or cope with whatever is having, but it might cause a little bit more stress on someone who doesn't have the means, right? The demand to go through through that stress. So stress can affect both our physical and mental health state, right? I think within also, I would, I'm going back to the last year because I feel that, mental health has been a big topic for everyone, as everyone, I guess, realized how much stress can affect us, right? And it can be displayed in so many ways. And so, headaches, stomach pain, constipation, loss of hair, lower sexual drive, muscle tension, back pain, crying spells. All these are normal. All these are very, very different for everyone. But these are ways that stress is showing us, right? That we're not okay. It's our body telling us that we're not okay. Now, when we have a long amount of stress for a long period of time, then we go into what's called burnout. So this is a prolonged response to chronic physical and emotional stressors, resulting in exhaustion and ineffectiveness, right? So we might be stressed, but maybe not burned out yet. But then we could get to a point where we're burned out. It's just too much, right? We're not functioning anymore. And now there's another term, very important. And I think in the last year and a half, we probably have felt all of these, right? And so we have compassion fatigue, right? This is known as secondary traumatic stress and associated with the cost of caring for others and emotional pain. So this is just when, you really feel for others, right? You just don't feel, but it's really affecting you too, right? So that traumatic stress of someone else is really, really, passing over to you. And so, we can go through these, stress, burnout, compassion fatigue, in different periods of our life, right? For different reasons. And so one thing that I wanted to clarify, I always do this with stress, right? Because I've done other presentations about stress, but I also like to say that, is stress completely bad? Is it really bad? I personally don't think so, right? Because stress is a signal from our body, right? It's just sometimes that we're not very aware of it, or we don't know what to do with it when it becomes where I think it could become bad, right? But stress is it's a sign. It's a sign that we need to do something it's a sign of protection, right? It's telling us, hey, something's not right and you have to do something about it. The thing is that, we're going 100 miles per hour a day, right? And there's life and a million things we have to do. And so we kind of lose track of that's the self-care. And so we'll go to the other slide. Thank you. And so when we're feeling stress, our body prepares for survival, and it's using up all the energy and all the resources in our body. And so when we are in this, alert state where we're super stressed, our body goes into our fight, flight, or freeze response. And there's two areas that are, attached to the fight or flight or freeze response. And this is the amygdala and the prefrontal cortex. The amygdala is in charge of threat detection and emotion, and the prefrontal cortex is for conscious thoughts. So what happens when the brain releases these hormones, right? Epinephrine, which is the adrenaline, and cortisol, which is cortisol is like the alarm system, let's say, in your body. So when these two levels, there's research that shows that when these two levels remain high for a long period of time, it can impair your memory and your learning. And so this I was tying it to, some of people who have lived through traumatic experiences. Sometimes they can't recall. And so why is it that, people can recall a traumatic experience? And this can be because, these hormones are so high, they're in an alert level, in survival mode. And so it's impairing those areas of our brain that lets us remember. And so work-related stress indirectly affects the organization and the patients. So of course, right, if we're not feeling well, it shows in other ways. It shows at our work. It shows with the people that, we're supposed to care about. It's kind of, we need to take care of ourselves to take care of others, right? And so we provide lower quality of interventions to our patients when we are very stressed.
I think you make a really good point here, Andrea, about the that acute stress response that, that we're in the fight or flight um, response that our body gives, especially for frontline workers that are either in healthcare, or some aspect of it, because they're on such high alert, and individuals were, they were exposed to such traumatic experiences, dealing with so many deaths and so much trauma. It accumulates, and as you mentioned a while ago, we've been in this, in this stressful event, in this crisis now for a little over a year and a half, or yeah, it's been a year, a year and 2 months already, so to speak. So, just the accumulation of all this stress response, it has its implications and its bearings on not only our physical health, but also our mental health. So I think you made a really fascinating point here. Thank you.
Yeah, and I actually forgot, but I was gonna share that, part of my role in the hospital during this pandemic, it became to help our frontline workers, right? And give them, make sure that they were okay while we were dealing with all this craziness in the hospital. And so we created a program for everyone, for all of the hospital staff. We would go to everyone and basically just do check-ins. And I think later on in our presentation, we're going to talk about the importance of checking in with yourself, but also checking in with others. And so what I noticed through the check-ins that I was doing, it wasn't so much I guess that they wanted feedback, or that they were asking like, what do I do? But it was more of the attention and the listening part that was so important. And, we don't, we're so busy all the time that we don't usually give ourselves the time to fully listen, right? We have our phone, we have our computer. And so it was so important to do these check-ins, and like the attention and the listening part. Just listening is so crucial, and someone dealing with stress. And so yeah, definitely we were dealing with a lot, right, the last year for a lot of our frontline workers. And so okay, we're going to jump to the next slide. And so, these are some of the stressors and triggers, right, that can happen. So stressors and triggers include people, places, things, experiences, right, situations. So why is it important that we know that stressors can be any of this, right? And so I think that, when we become aware of what exactly it is that is our trigger, then we have power, we have a choice, we become, we're able to decide what we want to do with these triggers and stressors. And so, people can include your spouse, right? And they can be stressful, kids, coworkers, supervisors, in-laws, parents. For places, of course, work, home, a hospital can be a stressful place. Things such as a cell phone, a computer, experiences, situations, of course, we've been mentioning the pandemic, traffic, or feeling sick, like, or someone in our family being sick. All these are really can be very stressful, right? Especially if we combine a couple of them or have them for a long period of time. And so the idea is that we say, have we even thought about what it is that is stressing us, right? Is it a place? Is it a thing? Is it a combination? And what are we doing to remove that stress, or to maybe not remove it, right? We can maybe remove some of the things we have here, but maybe like the people, right? We can't maybe just remove those in total. But
yeah, it'd be tough to remove our significant others or our kids, so
yeah, exactly. So yeah, maybe we can't get rid of them so easy, right? But what I mean is, what do we do to make to feel better? What can help? Have we even thought about what we can do to reduce that stress or make it better, right? And so these are just things for you guys to think about, right? What do your triggers include? What are your triggers? And if you were able to identify them, have you done anything to try to make yourself feel better, or help them out, right? And so that's some of the things that you guys can reflect on.
I think that was really, really informational. So thank you, Andrea, for giving us the heads up, if you will, on what stress is and the difference between stress and burnout and compassion fatigue and all that. And so I'm seeing some really good, back and forth in the chat. So thank you for y'all's participation. Remember, if you have any specific questions, go ahead and put it into the Q&A. That way we can address it at the end of the presentation. So I'm going to go ahead and talk then a little bit about the Hispanic or Latino culture. We're going to get specific information with different ideas or concepts that are again just specific to our culture. So here we go. Let's talk about the concepts of machismo and marianismo, just to start off with. Now, machismo, when you're thinking about it in a cultural view, this portrays the ideal man as being domineering and possessive and potentially even unfaithful. One of the things that when you hear the term, oh, he's, is machista, or this, that's macho, we have a very negative connotation. Now, there's also a positive side to machismo. With regards to the Latino or the Hispanic male, a person who is exuding this machista tendency is also one that works hard to be a provider for their family. So then we look at what we see via Merriam-Webster and the dictionary. It is a strong sense of masculine pride, again, an exaggerated masculinity, or an exaggerated or exhilarating sense of power or strength. Again, highly negative in the connotation, but there are definite positives to the machista tendencies as well. As I said, protective of the family, that strong desire to provide for the family as well. Now, the opposite of machismo and just in gender terms, if you will, is going to be marianismo. This is the cultural portrayal of the ideal woman as being submissive, self-sacrificing, and modest. Now, again, this self-sacrifice is going to be very common in what we see in Hispanic or Latino women and or mothers. And so Marianismo, according to the APA dictionary, we see as an idealized traditional feminine gender role that is going to be characterized by the submissiveness, the selflessness, chastity, this hyperfemininity and acceptance of the machismo in their male counterparts. Now, why Marianismo? What's the significance of Marianismo? Now, Marianismo was named, if you will, after the Virgin Mary. And so that's where we get the term Marianismo. We are to be like the Virgin Mary in that respect, being, again, submissive and selfless, if you will, when we are dealing with others. We'll also talk about familismo. Familismo is going to be that idea that we are all about the family. Okay, it connotes a specific commitment to the family dynamic and working together and participating and having those strong relationships, not only in the nuclear family, but also in the extended family network. Now, I don't know how, if I know anyone of a Hispanic or Latino origin that has not had an extended family member, kind of be raised by by someone else or live with them for a certain amount of time in order to help the other the other family out. I was fortunate in my family of origin to be able to house maybe 2 or 3 different cousins that once they transitioned from high school into college, community college, they came and they stayed with us during their time in community college. So, this is what familismo is, being able to help family out. And so again, it suggests that attribute of collectivism or that interdependence, the one on, on the other. And so collectivism is going to be the practice or the principle of giving a group the priority over each individual in it. And so what we see within the Hispanic or Latino culture is that we are very collectivistic. We are not individualistic at all, by no means. Again, and this is just a cultural norm, if you will. We do the best for the family, and more often than not, if we try to do something as an individual, we might be chastised by our family or what have you. So anyhow, again, just within the Hispanic culture, this idea of collectivism, it's something that we do live by. And then this last term, the nepantla, this is the concept of in-betweenness, that in-between of a Hispanics minority culture and their and the majority culture. So the nepantla, what that means is, and I apologize for in advance for my very humble example that I'm going to use here. But if you have seen the original Selena movie, you'll notice that conversation between Edward James Olmos and Jennifer Lopez, and they talk about how being a quote unquote Mexican and an American is exhausting, because they have to be Mexican enough to satisfy Mexican cultural norms, and they have to be American enough to satisfy American cultural norms. So that's what nepantla, in a nutshell, that's what that is, that in-betweenness. I often refer to myself as a Mexican American. And then I understood that, hey, okay, Hispanic is an all-encompassing term, but I am very proud of my Mexican heritage, and I am very proud of my American heritage. And so I'm fully bilingual. I can speak Spanish very well. Actually, Spanish was my first language. So again, this in-betweenness, I have to be Mexican enough to satisfy my Mexican cultural or my Mexican heritage, and I have to be American enough in order to satisfy, American norms, if you will. So these are, again, just some of the cultural concepts that I wanted to cover with everyone this morning. So when it comes then not only to our culture, but also, our language and language barriers, and then the context. I know that Andrea brought up a while ago how traditional medicine tends not to take cultural considerations when, we're talking about some of these things. And so there are these barriers that exist, again, within language, within culture, and within the context that occur between health professionals and their clients or their patients. And these are often the reasons why the Hispanics or Latinos tend not to either seek treatment or they end treatment prematurely. So language is going to be considered one of the biggest significant stressors for many Latinos when receiving medical services. I don't know how many of y'all have, I'm sorry, that's my Texas coming out. You'll hear me say y'all a bit, but I don't know how many of y'all have either served as an interpreter for maybe a family member or an extended family member. Tengo cita con el doctor, ves conmigo, mija, para que entiendas lo que está tratando de decir el doctor. Hey, can you go with me to my doctor's appointment? I really need someone to be there to be able to explain to me what it is that the doctor is saying. So again, language is going to be one of the biggest deterrents, if you will, to receiving adequate medical services. And then some of the idioms of distress, again, this cultural mode by which some of these individuals express their personal and psychological pain. That chart that Dr. Almaguer showed a while ago, with regards to the problems and the helpers, we saw that, we're going about our day, and I don't know, you get a headache, and it just so happens that day, you were wearing a cute top, or you got new shoes or what have you, and within our cultural norms, we assume alguien me hizo ojo. Okay, so, but you can't go to a doctor and tell them, pues me hicieron ojo, because they're probably going to look at you kind of weird. So again, we assume that a somatic issue might be medical rather than something more emotional or psychological. When my baby sister was born, she's got these beautiful green eyes. They're crystal clear, beautiful eyes. My mom hung an ojo de venado. It's a precious stone. She hung it from a little necklace or whatever to ward off the mal de ojo. So again, these are cultural and contextual issues that growing up I was exposed to with my Hispanic culture and upbringing. And then again, these idioms of distress can often be misread even with an interpreter present. So one of the things that I'm actually working on is the use of some of these cuentos, illustrations, these phrases that we use to kind of put things out there, like, oh, I went out on a limb. You can't translate it into Spanish because it doesn't sound the same. And so sometimes these idioms, these cliches, if you will, there's misinterpretation there. So it gets difficult as a let's say a Spanish speaker to go into a medical office and not be able to communicate appropriately. So again, these are some of the barriers that we have seen with regards to healthcare in the Hispanics. And then, obviously lack of insurance also ends up putting up that barrier, if you will. Many Latinos, unfortunately, might not have medical coverage, and therefore there's a lack of access to healthcare. So for example, here on the border, it's common that Latinos will take their health issues into Mexico for treatment over there, or we go to non-medical healers, such as the curanderos, the espiritistas, the sobadores, hierberos, all of these types of things. Oops.
Yeah.
Is that it? Oh,
Yeah,
no, hold on. There was one more slide. I apologize. So when we talk about Hispanic, Latino self-care options, it's important to understand that self-care isn't going to look the same for everyone, because not everyone has access to the same amount of resources. It might be easy to tell someone, oh, go get a massage, go, go relax, go to the spa. But not everyone has access to those same resources. It costs money to go get a massage, or to go get a mani and a pedi, or to go, take a day off from work if you don't have PTO. Then within the Hispanic Latino culture, life difficulties, for the most part, we're taught to kind of endure them and handle them and just push through regardless of what's going on. Quitting is not an option. I don't know how you were raised, but in my family, quitting was never an option. And then again, Hispanic or Latinos tend to underutilize mental health services. Los trapos sucios se lavan en la casa. Like, we can't let people on the outside of our family know what's going on within the four walls of our home. And then again, health is going to be defined by tradition traditional healers known as the curandero, the curandera. And so that state of balance between the body, the mind, and the soul, or the spirit, that's where we kind of, okay, well, it might be my spirit that's malaligned with the rest of me. So we tend to seek other options. So it's important to take all these cultural considerations into mind, if you will, and have them present when we are deciding what type of self-care options are available to us. And so these next few slides, we're going to talk about wellness. We're going to talk about, that balance, if you will, how to maintain a balance in order to promote self-care and overall wellness.
Okay, and so, now we've covered, stress and a lot of these cultural values that might play a role in the stress and maybe the way that we think or reach out to, healthcare services. And so, when, wellness is defined by the Global Wellness Institute as a pursuit of activities, choices, and lifestyles that lead to a state of holistic health. And I like this definition because it says the pursuit. And so it's like, it's not something that just happens, right? Wellness is not just something that might come to us just generally, like we just have it, right? It's something that we kind of have to work at. It's like this, the self-care. We have to work in our self-care to maintain wellness. So it's something that we constantly have to be, evaluating and seeing, where are we and where's our balance and what's unbalanced, right? And so this model, I really like to use this model for, a lot of the presentations when I discuss, wellness, because I feel it covers different areas, right? So as you can see in the little chart, we see emotional, spiritual, intellectual, physical, environmental, financial, occupational, and social. And so it's a very holistic approach. It's covering almost, everything that we can think of the roles that we might have as an individual. And so when we're looking at wellness as being healthy in many areas and dimensions of our lives, so it's, again, holistic, different areas, recognizing that culture and spirituality will impact our perceptions and everything that we do. So part of what I like about this model is that, when you look into this model and their explanation is that they really value culture, the individual's culture when looking at this. So it's always considered, because this is going to change a lot of our perceptions, right, into these areas. And so the one that comes to culture, right, is that, a mother might be a stay-at-home mother. It's, that's her occupation. Like her occupation might be very important, right, being a mom. And so if we don't look into the culture and we don't consider that maybe for the Hispanic and Latino culture, that's a very important role. If we don't value that, then we might think, well, what's going on with the other areas, and why don't you try to focus on some other area? And so, it's important to keep culture in mind when we think of these areas, right? And so I think, like, what I wanted you guys to think about and maybe share it on the chat, just so I can read a little bit about what you guys are thinking is, do you guys focus on the same do you focus on the same areas more than others? Like, are there some areas that you really focus on and you leave some other ones behind? Which are those that you focus on, and which are those that you really don't pay attention to? Maybe right now you're thinking, I really don't pay attention to the environmental or the social part of me. I've been lacking that one a little bit. And so do you think that the ones that you lack or the ones that you focus on are related to culture? Do you think that your values and culture affect how you focus on these areas? So share those responses so I can read them. But sometimes there can be more than one dimension affected at the same time, or one dimension can affect another, so that we know that if there's one thing happening to us, it affects it affects other stuff. It affects our whole self, right? And so think, what's the what's affecting me right now, like what's happening, what kind of area is being affected more directly, but which other ones are being affected indirectly because of this issue, right? And so this is just a very neat, a little chart for you, like visual for you guys to identify those areas. And so again, self-care, is so important to maintain our wellness, but self-care just doesn't come alone, right? It comes with, we need to act on it. We need to act on self-care, right? Self-care is an act in which we engage in. And so in our references, you'll see the Substance Use and Mental Health Services Administration reference, which is a reference for this wellness little chart. And the link on the reference is for an activity for this specific slide. And it's so neat. It goes through each section that has questions for you guys to answer, and then things to, I guess, reflect on and see if you want to fix. So I invite you guys to look over it if you have, more questions on this. Really nice activity for you or for others if you're in the healthcare field or mental health and you want to give it to some of your patients as well.
So now we're going to get a little more specific with regards to self-care and the Hispanic or the Latino individual. So one of the things that really got me thinking during COVID, our lockdowns and all that was, again, with Hispanic and Latinos, we are very collectivistic. We are, very central to the family. And that's, again, very important for our well-being. So just various options that we can utilize with regards to our self-care. And I know, at least here in Texas, the majority of the restrictions have been lifted. I don't know about the various states that y'all are joining us in from, but again, that was one of the reasons that I started thinking about, okay, well, what can we do as Hispanics, as Latinos, to kind of keep our wellness and our balance in check, if you will. So here are some of the self-care activities that we tend to participate in. We've got self-nourishment, we've got physical activity, self-medication and the use of substances, we've got reconnecting, we've got pláticas, and then with our use of our religious or our spiritual senses, if you will. So we're going to go into each of these specifically. So self-nourishment, I don't know how many of y'all had an abuela who fed everyone and fed them hasta de más. So that is what self-nourishment is all about. Feeding yourself, feeding your friends. Unfortunately, we had to kind of do away with that during lockdowns, and it was very difficult because we were so used to welcoming folks into our homes to feed them and entertain. So we tend to seek comfort in certain foods. I don't know what your comfort food is. Mine is enchiladas. Just making them. My husband loves enchiladas. I make them for him at least once a week. And it's a time-consuming, tedious process, but it's something that I enjoy and I get comfort from. I'm able to kind of just decompress, if you will, by making some of these foods. So right now I want for you to kind of think about what some of the foods are that you tend to gravitate when you're feeling stressed or overwhelmed. Yes, these are what we call, quote unquote, the comfort foods. Is it caldo de res? Is it caldo de pollo? Is it, something a little less cultural, if you will? I don't know what those are. If you want to put them in the chat, that would be great, just so that we can get ideas. Okay, so we have Mexican tacos and chalupas is one of the what one person is saying. Anything that includes plantain, there you go. So the tostones, yes, the mofongo, very good. Thank you, Richard. Thank you, Marisela. So again, when we feed ourselves, we don't just feed ourselves physically, but we're also feeding our soul, if you will. So Sopes. Sopes are good. Deshebrada on some sopes. Oh my goodness. I'm getting hungry and it's right about that time in my area. Caldo de pollo, flan. Oh my goodness, desserts. Yes. Okay, let's move on from food because I'm getting hungry. Wait a minute. I just said we're going to move on from food. Sweet cookies or empanadas. All right. So nutrition and sleep. Do you have access to some fresh and healthy foods? Are you in a position to eat at home so that you can keep better track of what you're putting into your body? Are you trying to improve your diet by setting maybe small goals? So you can make these small changes every day, every week, every month. Small change leads to bigger changes. And so this is one of the things that we have to take into account when it comes to just how we're taking care of ourselves nutritionally, what we ingest. And then our sleep. Okay, are you getting 7 to 8 hours of sleep a night whenever possible? Now, some folks need a little bit more than the 7 or 8, and some folks need a little bit less. But what we see on average is anywhere between 7 to 8 hours of sleep is what's going to be the most beneficial for folks. So I don't know what your average sleep time is, but if you're struggling with sleep at night, then we have to take a look at what's called your sleep hygiene. What are some of the things that you're doing? What are some of the habits that you have in place that we need to either change or modify in order to improve your sleep at night or the quality of sleep? So try avoiding exercise right before you're trying to go to sleep, trying to avoid screen time. Now, for those of you who are unaware, there is an option on your phone that you can change the screen to a night screen, and it reduces blue light, which helps promote sleep. So are you avoiding large meals before going to bed? Are you avoiding caffeine? So if you have a large meal right before bed, and I don't know how many of us Latinos or Hispanics do light meals, but I know that I enjoy my large meals. But anyhow, are we avoiding that right before going to bed? If we aren't, then our body is going to be in a state of unrest because it's digesting the food. So we do have to make these subtle changes, if you will, in order to promote some of the bigger changes. So trying to manage our routine, carving out time for rest and sleep during the course of our day are going to be crucial in promoting the wellness. Physical activity. I was sharing earlier that I started being more proactive in my approach to wellness. As I started working on the presentation, I was like, dang it, I don't do a whole lot of physical activity. So I upped it up a notch, and I started running, and I've been running now daily it's actually been a month. And I'm up to running 3 miles a day, which I'm really, really proud of. But anyhow, when we're talking about physical activity, have you identified, do you know what your BMI is? Have you tried starting to work on it? And again, those small steps that lead to bigger changes. Have you been taking shortcuts to exercising, like parking further away from the store or taking the stairs instead of an elevator or escalator? These small changes, these small steps, ladies and gentlemen, can help in the long run. And then again, are you getting regular physical activity whenever you can, and even trying to make it fun? Get an exercise partner to go out, to go work out with, or go for a walk with, or even bike riding. I know there was a time after lockdown that I was looking for a bike, and I could not find one within like a 30-mile radius from my hometown. Like everybody went out to go buy a bicycle. So physical activity, we need to do things during our day to help promote this wellness, promote the balance, if you will. So one of the other considerations is the use of various substances, if you will, in order to self-medicate. Now, Latinos tend to be a bit reluctant when it comes to taking medication. There's an exception with regards to antibiotics. Those tend to be overused actually within the Latino culture. However, I don't know about y'all, me, if I have a headache, I try to do other things rather than, go straight for the Advil or the Tylenol. I try to do other things to kind of promote that wellness, if you will. So I know I am one of these that is reluctant to take medications, whether it's over the counter or something prescribed. College students have indicated a favorable view of the use of cannabis to help cope with anxiety, and that was a research project that I completed with some of my colleagues a few years back. And so what we saw was that the views held by young adults is, hey, if it works, then do it, type of thing. So the other thing that we've seen, and I don't know, we don't have any research as it is right now, but there is anecdotal evidence, just because I have seen a lot more clients with alcohol use disorders that have kind of gotten worse due to the pandemic, due to lockdowns, is the increase in alcohol use since the beginning of COVID-19 crises situations here locally, if you will. So self-medication, we tend to, again, kind of go towards the route of alcohol, tobacco, maybe other drugs. Other things that we use as self-medication tools, especially again within the Hispanic culture, are going to be your tés, té de pasiflora, té de manzanilla, things like that. So going back to the alcohol, the tobacco, or the drugs, have you tried tools that are going to help you kind of cut down or quit using some of these products, some of these substances? And then, are you reaching out to family or friends instead of using these substances while you're going through a tough time? Being mindful that our triggers might still be there, and we're going to have to learn better coping skills or coping mechanisms. So finding a support group, a 12-step group like an AA or an NA in our community, and attend these meetings very well might benefit or help us. Preventative medicine. Do you visit your doctor, dentist, or other healthcare professional for routine care and monitoring? Now, if you are a frontline worker in the medical field, if you're a healthcare worker, it is stated that doctors tend to be the worst patients. So I would assume the same would be true for mental health professionals and and nurses and anyone in the field, if you will. So it's important that we monitor our blood pressure, even our waist circumference, and our blood sugars in order to help prevent chronic conditions from becoming an issue. Are you storing medications properly and reviewing expiration dates? It's important that you do all that, again, in order to promote that balance and that well-being that we're talking about. And then, just in case of an emergency, it's important to carry a list of the medications that you currently take. Talking to your doctor, using that process of that shared decision making when you are unsure about a prescription or need guidance. That's what the medical professional is there for. Now, again, a while ago I talked about the use of tés or salves. Like I said, the té de tila, té de manzanilla, té de pasiflora. These are all teas that help promote calmness, if you will. So again, I asked the question, and this is just for reflection right now. You don't have to type it in the chat section, but what is your self-medication tool? What is your go-to with regards to self-medication? So just, again, something for us to consider and reflect. Say that again.
Dr. Chavez, I'm sorry. Yes. What I was thinking about also was that, the sharing of medication, of prescribed medication.
Yes.
I was thinking about, certain, back my family when
For
I was
sure.
younger, your
Yeah.
grandpa, your grandparents would give you medication that it was for them,
Yeah. Yeah.
even if it was for maybe the similar stuff, but just
Uh-huh.
sharing, with each other. Oh, here,
Yeah.
this is for you, and they'll give you, all this thing.
Yeah.
And, now thinking back on it, I'm like, it was so common, and for us to just share medication between us.
So even now, and I'm embarrassed to admit this, but my parents and I had COVID back in November, and my doctor prescribed a medication for my cough, which luckily, I wasn't on it very long because my cough quickly, it went away. And my mom's cough, got increasingly worse. And so there was an issue with her insurance not approving the cough syrup. So I was like, here, mom, you can have mine, type of thing. So again, I'm embarrassed to admit it, but, I did share that it was the exact same medication, but, anyhow, so she used mine for, a day or whatever until her prescription was able to be filled, which, it ended up helping keep her out of the hospital, which I'm grateful for. But anyhow, here we go with the next one. So reconnecting, my goodness. Okay.
Yeah.
I was looking at the time.
Yes.
We got to speed things up, Andrea.
Yes. Okay. So we are on the reconnecting, right? So we're talking about all these things, right? All these stressful things. And I feel bad in our presentations. Usually I talk about stress and then I'm like, I feel they're more stressed, but what do we do? And so we talked about wellness, but how do we reconnect to those things that are important to us? And so I was thinking, we need to disconnect to reconnect, right? And so what does disconnecting mean? I think it's like this time, setting away this time from right now, I think, media, social media, but also any triggers. And so anything that's causing you stress, try to identify them and, let's push them away and try to reconnect to those things. So is it what things make you feel connected? Is it a certain people, places? And we seek to reconnect with an object or activity close to your heritage. Comfort food, like we talked about, music, a blanket, listening to a song that reminds you of your grandma or just something. So find these things that help you reconnect. And so because of time, I'm going to move towards what I really wanted to do, which is a little mindfulness activity. So most of my research has been done in mindfulness, and so first I want to do a real quick guided imagery with you guys, and then we're going to do a little mindfulness practice using music, just kind of an example as to how you guys can use this at home. And so if you guys are, if you're in groups, I know I saw someone in chat that you guys are in groups, just go ahead and sit down. I'm sure you guys are in a chair. So try to relax, sit down back, and just try to relax. We're going to do this activity. We're going to close our eyes. Okay. And so I'm going to guide you through this guided imagery activity. All you have to do is listen, take deep breaths as we begin to relax. We're often, going really fast, and this is just a moment to take everything in, connect with your body. So take a deep breath. We breathe in through our nose, and you want to breathe out through your mouth. And so as you're breathing, you feel the air going in through your nose into your lungs. You feel your lungs expand, and you breathe out. And I want you to imagine that you are traveling to a safe place. This is a place where you've had special memories, special moments. This is a place where you have your values. This is a happy place. It can be something from before when you were younger. This can be your grandparents' house, your parents' house. It could be your home, somewhere where you feel you connect to who you are and where you come from. Now, as you're in this place, I want you to think of what you want to take with you from this experience. What does this memory give to you? And take these values and positive memories with you. This memory is a reminder of who you are and where you want to be. And just allow yourself to connect and feel. Okay, so we're going to take 2 deep breaths and slowly come back to the presentation. Open your eyes when you're ready. You can do a little stretch and with your head and your hands open and close them. And so, as you guys are coming back, I hope that you guys were able to time travel for just a few minutes and seconds because we're running out of time. But this is such an easy, cost-effective practice. You can do it anytime, anywhere. And so it's just a very easy activity that we can do and also do with our kids, and just kind of with our family, right? And just kind of remember all these things that are important to us and just kind of become aware. And so we're gonna move into the mindfulness practice using a song. Okay, so just real quick, we're gonna do very similar. So you can just sit where you're at and close your eyes if you want to, or just keep your eyes open. The idea is just that, pay attention to the song, stay connected to your body, and just kind of be aware of what comes, what thoughts come to you, what feelings, maybe what you feel in your body as you're listening to the song. So I'm hoping you guys can hear the song okay, okay? So just try to relax in your chair.
Te regalo la primera planta que en mi vida yo sembré en la tierra. Te regalo el cofrecito que antes de morir me regaló la abuela. Te regalo la emoción que sentí al ver nacer a mi primer hermano. La sonrisa de mamá al verme deletrear y mis primeros pasos. Mi primer amor de infancia y mis primeros zapatos. Mi primera travesura y el desorden de mi cuarto. Mi primer amor de infancia y mis primeros zapatos. Mi primera travesura y el desorden de mi cuarto. Mi primer día de colegio, mi peinado, mi primer cuaderno, mis amigos de secundaria, mi pasado, todo eso. Mi primer día de colegio.
Okay, so now we'll come back to the presentation. I chose a song that was it's not a very actually common song, but it's a song that I heard before, and so just because of the instruments and everything that the song says as well, I thought it was cultural related, to our Hispanic and Latino culture. And so the idea is that we can use different things to connect. So I hope that you guys liked the song, and just, I know it was very quick, but you guys feel free to also send me an email if you want more activities on mindfulness. And so, okay, we'll move on because of time.
All right, as if you haven't already noticed, I love to chat, I love to talk. And so one of the last, I guess, self-care practices that we can use is the use of pláticas. Surrounding yourself with individuals that are going to help build you up and not tear you down. There's the dicho, dime con quién andas y te diré quién eres, okay? Are the people that you're surrounding yourself with, are they negative people, or are they positive thinkers? So, one very, very effective way of managing your overall well-being is surrounding yourself with positive people that are going to support you, people that are going to again build you up rather than tear you down. So we need to be careful who we associate with. Are they weighing you down, or are they lifting you up? Are they vibing positive or negatively towards you? So again, a way to reflect on this are, who are the people in your life that help contribute to your well-being? Those are the people that you need to keep. People that are not contributing to your well-being, these are people that we have to reconsider their role or how much impact they have on us. So again, the use of pláticas, very, very, very effective tool in self-care. And then lastly, just the use of religion or spirituality. There is indication, and there's research out there that proves that prayer and meditation can help change the way that a person's reaction to various stressful situations can come about, and even just their outlook, if you will, and their prognosis with regards to certain situations. Attending church services or mass, whether it's online or in person, doesn't really matter. But these practices also help manage that wellness that we're talking about. Singing various worship songs or hymns, either listening to them in the car, singing them in the shower, or just busting out in concert, while you're at home or what have you. Singing and again, listening to some of these songs can help uplift your spirit. Remember, we talked a while ago about that balance between the body, the mind, and the soul. So this helps. A lot. Pastoral guidance, seeking pastoral guidance from our priest or our pastor. These are also, effective tools for us. So again, reflect a little bit. Have you used some aspect of your spirituality or your religion to help you through a tough time? If so, then, and you realize that it was effective and it was useful for you, then practice, getting into a practice of it is going to be good in managing your stress levels. So there are various other self-care options. We're running out of time very, very quickly, but what have you done that has worked for you? If you can share real quick on the comment section. I know it was, we explored here towards the end, and I had you reflect. We had you reflect on various ways to manage your self-care. But if you have anything else that we didn't talk about, bring it up in the chat section. I want to encourage you to practice some of the mindfulness techniques that we talked about, and some of these other self-care practices that were discussed. So overall strategy. I always hate that word. Various tools to help us alleviate mental health stress or mental stress will include just that self-monitoring, regular check-ins with yourself, with others, identifying your triggers, working in partnerships or in teams, brief relaxation or stress management breaks, regular peer consultation and or supervision, and then reaching out to a mental health professional if you feel that it's a necessity at that point. But other than that, and again, I apologize that we're kind of rushing through the last few slides. There were 2 questions, if I'm not mistaken. So Lonnie talks about being a first line responder. Our training mode that drives us is to continue without that self-care mode. What approach should be used? I think that, you know, for a great majority of us, we turn on the switch and we forget to flip it off. So the approach that should be used here is probably going to be actually switching it off and taking that break. Taking breaks during the day, at the end of the week, I don't know, find something that works for you, but literally we got to switch that switch off. We got to turn it off. And then Maricela states, parents are emotionally fatigued with their kids' lack of motivation with regards to school. They are frustrated and annoyed with their kids' lack of being proactive with their schoolwork. All year long, kids have not logged into their classes. What type of feedback would we provide to a parent who is feeling this way? And where as clinicians do we draw the line between a client being lazy, oppositional, defiant, and mentally struggling with their daily life activities? So what type of feedback to give to the parent? I think it's important that parents understand everybody is struggling. It's not just the kids. Students last year are struggling right now. They're C students. I'm seeing it with my own clients. So they're not in the proverbial boat alone. So helping the parent address not only the educational needs, but also the mental health needs. I think that as clinicians, it's our not only our prerogative, but it's our responsibility to assess whether they're just being lazy, oppositional, or defiant, or if they're actually mentally struggling with something. So assess for depression, assess for anxiety, and treat the underlying issue, remembering Maslow's hierarchy of needs, and that at the base of that pyramid are your physical needs, and your very basic needs. So school might not be at the top of their priority list, because right now they're freaked out about the virus, or they're freaked out about how much work has compounded and accumulated over the school year. So I think it'll all come down to assessment and the relationship between the parent, the child, and even the clinician, just forming a team, if you will, a therapeutic team for the family.